Code white, 2 southeast. Code white, 2 southeast.
It was very rewarding my first day on the job.
I love that.
Just took off. Have never seen a more worn down vibrator in my entire life. And one of them, towards the end of this day, was like, "Hey, do you remember when I used to smoosh on my face?" And it flew out of the bed, rolled on the ground to a security guard's foot. He just goes, "Oh, what's that?" Sometimes they're so resistant to take their medication. Like, oh my gosh, please, like,
just take them.
We could. We'll play chess after this. Do it. I could not care less. I'm not gonna look at your DM. Like what? Like.
Hi guys, welcome back to Grippy Psych Talk. Today we have an episode of Healing Out Loud, and Jen and I have a very, very special guest. You might know him. His name is Jack Svetz.
Hi there, Jack here. Welcome to another episode of Tales from the Psych Ward, where something happens to me at the Psych Ward and I tell you about it.
Hello.
Hey there. How's it going? Thanks for having me on, Steph and Jen. Appreciate it.
Thank you for
You're
being
welcome.
here.
Thank you for being here. So if you don't already know who he is a psych ward nurse, comedian, and I consider him an influencer.
Thank you. I appreciate the title.
Yeah, it is. He makes absolute funny videos of the terror he goes through on a daily basis, okay? If you have not checked him out, you have to. Jack Svetz, the name's right there. You have to look at his videos. It's insanely hilarious. So we're just going to start with, can you tell us a little bit about your background and what led you into this field?
Yeah, absolutely. So as Steph said, I am a psych ward nurse and also a comedian. I actually was a comedian before I decided to be an RN. I started stand-up comedy in college at 19, up in Flagstaff, Arizona.
Wow.
Beautiful town. Beautiful town. Highly recommend it. If you want to go to college, go to Flagstaff.
Awesome.
Especially if you want to be a nurse. It's like one of the best nursing programs in the United States. So
so for
highly
both
recommend
nurse
it.
and comedian, you went to the same?
Yeah. So I went in like kind of undecided as my major. Started doing stand-up comedy, realized that if I wanted to do stand-up comedy full-time, I kind of needed to live wherever I wanted to live. And I didn't want to be those like artists that are like, you have to commit to the art. You can't have like a full-time job. I was like, I'm gonna have a career. Okay.
Yeah.
I can live in an okay apartment and still chase my dreams.
Yes.
And so that's why I chose nursing, is because it was 12-hour shifts. I could work like Sunday, Monday, Tuesday, and then go on tour the rest of the week and all that jazz, and and decided and ended up in the psych ward basically. Moved out to Southern California and got a job, and here I am. Yeah.
That is awesome. So, you mentioned psych ward. Were you always a psych ward nurse, or?
I originally started at a skilled nursing facility, which a lot of people would look at as a nursing home or like an old folks home, all that jazz. And so I worked there for a while, and that was brutal. It was like 20 to 37 patients for me, like fresh out of nursing school. Terrible. I didn't know what I was doing at all. And they knew it. A lot of them knew it. A lot of them were like, he has no clue. And I'm like, we're going to figure this out together. We're
That's
like,
insane. My
they
mom
were like,
was
"You
a
wanna pack this
PSW, so.
Oh, okay. Yeah.
In an old folks home. She was telling me the ratio of patient per nurse or PSW workers or LPN it's ridiculous.
No, it's crazy. It's really crazy. And shout out to LVNs, but also most of my coworkers were LVNs. So it was like, they had been doing it for 20 years, but I was still like higher than them. I'm like, it was super weird. And so they're basically the same. To be honest, they're basically the same. There's no difference.
I
agree.
I agree. Yeah, for sure.
I always said my nurses were my favorite people because they're sometimes they do more than a lot of the doctors.
Yeah.
Well,
I mean, no, shout out to my doctors. Shout out to my doctors. Yeah, but yeah, I mean, we see them a lot more. We see them just constantly. Even when it's 37 patients, you still seem to find time to have quality time with each and every patient. I mean, You
I
know,
love
some
that.
of them won't remember you had quality time with them, but you still had quality time with them, and that makes a
And that's
difference.
exactly it. Yeah.
That is, and that's what Jen always said as when she was a paramedic, that she would love them for the short amount of time that she would have.
Had them.
How did you say that?
Yeah.
The exact.
I said that someone needs to love them for that brief amount of time in the worst day of their life, and that person is going to be me.
Yeah, exactly. So
Yeah.
yeah. What was your very first day on the job like? And I guess I'll say psych ward nurse for this question.
My very first day on the job. Ooh, that was. I remember walking in so I'll backtrack to nursing school. I did my clinicals I did some of my clinicals at a psych ward as you do rotations and whatnot. And I remember walking in there being like, I do not want to do this. Mostly because I was like, they are going to keep me. I was like, I have mental health issues myself. There's like no difference. None at all.
It's a fair fear, man.
And I was like, I don't think I'm gonna leave. Like I was like, I feel weirdly comfortable here, but also not like, I was terrified. Somebody's gonna be like, you're bipolar. And I'm like, I'm not wearing it on my sleeve. I don't know how you even noticed.
Yes.
But they do. And so I did not think it was going to be for me. Was like, not going to do it. I think I'm too close to the problem, you know? So I didn't want to do it. My first day on the job, when I started my current job, I was like, okay, I think I can do it. I'm a little like, the time management aspect of it is interesting. I always wanted to go into cardiology, so it was vastly different to that. Yeah, I did my preceptorship in cardiology, and so I just never thought in this. Yeah. Mm-hmm. But I also kind of realized, like, a lot of people, if you've been a psych nurse for a really long time, there are some, like, you have a lot of person skills, but you lose some nursing skills. And so what I was like, it's kind of nice to come in with, you know, the ability to do wound care in my past, and IVs and all this jazz, and help out around the unit like that. Mm-hmm. Almost be like a utility guy, you know?
Yeah.
And so I kind of figured, I was like, all right, I have a place here. I think I can figure it out. Always been pretty personable, so being able to talk some patients off the ledge is awesome. It was very rewarding, my first day on the job.
I love that.
Kind of just took off. Yeah.
I love that, and it's so funny that you say, like, you're so close to, like, the patient in the mental health state, because the nurses that I had when I was in, one of them was like, you're no different than me. I'm on the same medication as you. Like, literally taking the same medication as you. I'm just on the other side, honestly.
And I think that helps.
Yeah.
Yeah. Yeah. I think that helps a lot. Like, you're able to, like, really connect with people.
And you have to in that job, like in a first responder or, you know, healthcare profession, you need to be able to connect with all sorts of people. Yes. Every different type of person, you know, and in every situation imaginable. So, it takes someone special to be able to do that.
Totally agree.
All right. So, what's the funniest or weirdest thing you've ever seen on the job? I mean, try to think of one.
I'm sorry.
I feel like I have to go. I'll go into categories. Okay. So the weirdest category of things I've seen on the job is how do I want to say this? People used to pleasure themselves with in the psych ward.
With what?
Yeah. What things people used to pleasure themselves with in the psych ward. Okay. Because we don't allow any toys in there. I will say, quick side note to toys. There was one time I was going through a patient's belongings, and I found a vibrator that was still vibrating. Clearly had been used like minutes before. And I give this lady props. Okay, she's consistent. She likes what she likes. Have never seen a more worn down vibrator in my entire life. Like I was like, the silicone's like gone. Like I was like, I could not believe it.
I don't know.
No, there's no, and I want to say there's no judgment here. Fully support that. I just think that's great to be consistent.
But like that's a new one for her because she's not getting anywhere else.
I mean, possibly.
I'm happy that she's just okay with doing it herself all the time.
Yeah. Look, and a lot, you know, and that's fine. There's no judgment. Do what makes you happy.
But for my concern here, and this might just be such a weird concern, is like bacteria. If the silicone is starting to tear off, wouldn't it like?
Yeah.
How do you clean it?
I'll be honest. I don't think that was her worry.
No.
I do not think that was in her top 5 concerns. at all.
Oh God.
Yeah, it worried me too. It worried me too, and I was just like, "What can you do?" All right,
nothing.
She's probably had that since the '90s. You know, like there's no doubt. I'm not gonna take it away.
First vibrator ever made.
Yeah, and there's it's.
I can't. I buy a new one. Like there's so many. Like oh my God.
I mean, look again. She likes what she likes. You know,
she likes what she likes.
She's consistent. She's consistent.
That's impressive.
Oh, but the weirdest thing, that was a weird one. The weirdest thing is I think I told this maybe a few weeks ago. We had one patient who I would consistently find makeshift all the time. Some of them were in the trash where I had to search through them because there was a lighter, so on and so forth, you know. But there was one time where she somehow got a hold of a nurse's possession. It doesn't matter. She was hiding them. No, like a credit card. I don't even know how it happened. I have no idea how it happened. Okay, but we had to like search her room and stuff, and there was a security guard in there. And what she had done is she got gloves. Okay, like gloves that we had thrown away in a trash can.
No.
Stuffed them with toilet paper. The finger hole was different every time, depending on her mood. Okay, so like sometimes it was the thumb, sometimes it was the middle finger. Okay. If it was light and easy, it was a pinky finger. But regardless, this one was ginormous. Okay, like ginormous. And so I didn't know it was in her bed, and I kind of did this with her sheets.
Oh no!
And it flew out of the bed, rolled on the ground to a security guard's foot, and he just goes, "Oh, what's that?" And I'm like, "It's exactly what you think it is. All right, let's not pretend to be shocked, okay?" And it was like, so she'd stuffed toilet paper in it. And so some of it was like she was very intricate. She was an artist, okay? An artist. Some of it was like ribbed, okay? Because like of how she'd stuff the toilet paper in. Like it was so impressive. Like I try and glass half full every situation where it's like, yeah, that's a little gross. You know, didn't want to see that. You have no other way. I guess you have no other way to go about it. Completely get it. I'm impressed, you know, like the creativity's there.
The imagination is good.
She made the veins? Like what?
Like veins or like ribs, yeah. It was like Michelangelo couldn't do better. You know, like
oh my God.
I'm crying. This is
holy
crazy.
Crap. My face hurts.
But literally watching that thing fly through the air, it was like slow motion. You know, have you guys ever seen SpongeBob?
Yes.
Okay.
Yeah.
So there's one scene I can specifically think of in SpongeBob where he like flips a patty and it goes in slow motion. That's what it was like coming off of the bed. Okay. So if anybody who like religiously watched SpongeBob like I did, you like imagine that patty, but make sure. Okay.
Oh my God.
So
and
you said that she would grab the gloves that were used.
She would you use what you can, right? I didn't realize this, you know. I had to kind of try and throw gloves. Not that I was trying to deter her away from doing that. It was more so, which you never do. We're just like, please close your door, you know. But
don't use used gloves.
Yeah,
please don't like invite me in, which has happened at times. But yeah, please don't use used gloves, you know. Like I don't know what you can use, but I had to try and figure out a way to deter her away from that, but whatever.
You can't. You honestly can't.
They're like, here's the thing: you're gonna get where you're gonna get. You know, if you want it, you're gonna find it. I'm not gonna. I can try. I'm not gonna stop you. I'm not gonna be able to.
You can't. Like even if you try your best to like have a specific garbage for gloves, she'll find something else. Trust. Like
yeah, no, and that's the thing. It's like what like. Is the glove worse than the next alternative? You know,
right.
I don't want to find out. It's not really something I want to find out.
No, I'm trying to think of like what else she could have used, and I'm like, we had access to bread, okay, and we have the bags. Like she could have used a bag for bread. Like everyone's touching that, so like, yeah, I guess there's no. She'll figure it out.
And also it's like bread is made with yeast, as we know. You know, you don't want to go through that route. You never know.
No,
okay?
you don't.
I'm not scientifically saying with a bag of bread is going to give you a yeast infection, but I'm saying the opportunity's there.
It has the environment to grow. Okay.
Exactly. Yeah. It very much does. There's a possibility.
Oh my God.
Oh my God, this is hilarious. I'm sorry.
This is the best thing of life right now.
Oh my God.
Okay. So, homemade vibrators. Amazing.
Yeah,
Amazing.
that's a pretty, that bummed me out a little bit.
I'll
initially.
send her
Got
money
used to
next
it.
time. I'll just hide it when you leave or something. Hide it in your
Oh my
prison purse and go in.
God.
I don't know.
Right?
So, okay.
Who knows?
Oh,
Okay.
all right. So, any moments where you, okay. So, any moments where you had to stay professional, but you were dying laughing on the inside?
From clocking in to clocking out most of the time. I mean, I used to have this patient that would like, when I first started, patients would kind of test me. Like sometimes we had patients there for a really long time, and sometimes not. But honestly, this is gonna sound mundane, but I have patients that will like, if I'm like scolding them, will just like laugh because I joke around with the patients a lot during the day, and it's really hard to maintain professional when I'm like trying to instruct a patient on what to do. Like, hey, you cannot go into another patient's room, and they're just like waving me off, like you're so
silly you.
I'm like I feel like a toddler having a tantrum. Like I'm being professional. Like
I'm wearing stuff.
This is my job. Okay, like you're so. Don't do it. Stop. That's really hard to maintain professional. It's also hard to. I used to have a patient who also would like smear feces all over himself, and then like I used to have but he would always he would make sure I had to see it before it could be like I could be working on a different unit, and if he did that, they would have to bring me over because he wouldn't let anybody clean it off until I saw it, and I'm like, you guys could just say I'm not on shift, okay? But no.
So is this another
I'd be on
artist?
lunch and he'd sit there for 20 minutes. Like and let it, yeah.
Another artist that's like, look at my work.
I don't know. Maybe one of his voices was an artist, but like it was more, I think it was more so because he just like wanted to watch me be like, what are we doing here? You know, this is
I mean, that's so crazy. So, okay.
That's insane.
I guess, what's your WTF just happened story? Besides that one.
My WTF just happened story?
Yeah.
Oh my gosh. I mean, I don't even know
where to start.
Like, where to start. Oh my gosh. So I had one patient who was super into her baby doll. All right. Everybody has like a little coping skill or like a thing that makes them happy. She had a baby doll. And we had another patient who was focused on her baby brother that didn't exist. Okay. And so you could kind of see where this is leading. This baby doll, after 10 minutes, after like I walked away for 10 minutes, somebody else was doing the floor. This baby doll turned from like the nicest, cleanest baby doll into what looked like Jack from Incredibles 2, you know, where he like is like on fire and flames and stuff. I don't even know how it happened. They got into an argument over this baby doll, and it's like it morphed into a different baby doll. It was like red. It looked like it had been dunked in Kool-Aid. Like it was like an interrogation for the baby. It was insanity. And here's the thing. I know this is like hard to visualize. Okay. I know this isn't the biggest WTF story. You can go on my page and see a lot of WTF stories, right? This is one that's like, I still have this like this baby doll haunts me. Cause it's not like a real, like I was like, I can't even believe how did this even happen? Like, how did you even get the materials for this to happen? I have like unlimited access to materials, and I could not turn that baby doll into that. That was like some witchcraft type of thing.
And in 10 minutes.
In 10 minutes, yeah. And
That's crazy.
So were one of these people a witch?
Jury's still out. If I'm being honest, no idea. Don't want to say no because then, but I also don't want to say yes.
Then they'll then they'll come after you.
The creativity in there is insane.
It's brilliant.
Insane.
It's so creative.
I want to.
That is like, if that's one thing psych patients have, it is creativity.
And it's the same for like prison, I would say.
Yes, because I would feel like a lot of prison is also psych in a sense.
Yes,
like
in a sense.
At least some.
Yes.
Prison is mostly psych, is some psych, right?
Yes.
So yeah, there's a lot of creativity that birds there too. I think when you're in a place where there's not a ton going on, you kind of almost have to be more creative in order to keep, ironically enough, some sort of sanity. You know? Yeah.
Well, yeah, because if you're in a place where there's not a lot to do and you let your mind wander, especially in any sort of incapacitated state, it's probably not going to end well for anybody.
No.
Oh, for sure.
No.
Nobody's going to have a good time.
Nobody's going to have a good time. No.
And I think like the reason sometimes the psych wards are so boring is because like I always describe it to my patients who are like, I don't think I can be in here for 3 days. I'm like, look, this is mental health boot camp. Okay. You kind of have to focus on yourself now. Let's work through these issues. You're in a safe spot where you can work through these issues. It's going to get a little hectic in that brain of yours, but let's figure it out. You know,
let's figure it out.
You got people to walk you through this trip, you know?
Right. You know, and I just have to, go ahead, Jen.
I was just going to say, in all honesty, and I used to love psych calls because I'm really good at talking to people. And I've brought a lot of people off the ledge and gotten them into the back of my truck to the hospital where they can get the help that they need. Like, and it's a humbling feeling, but it's also, it makes, it's nice that you have that capability to help a person in their crisis moment. So
yeah, because not everybody has that, you know. I think it takes a special person to do each individual job. Like,
absolutely.
I don't know if I could do that on scene. You know, like I'm in a it's a chaos environment, but I'm in a controlled environment, you know, to where like you really have to figure it out if you want to do it in there. Like,
and that's what I've said, you have to too, like, you have to be able to think on your feet on the trucks, like all the time, you know, like with every call really, but
right.
I don't think I could do what you do.
Right. It's totally a vice versa thing. And it's like, there's respect on every level for every position that's involved with
I'm just the patient.
Yeah.
I'm just
I
the
want
patient.
to do that.
We got you. You know, we got you.
Yes.
I got you. I told you I would take care of you.
It wasn't necessarily the most pleasant, but I wasn't unpleasant. Like, I got my chart, which is like, and I'm reading the nurse, and they're always like clean, kempt, pleasant today. Like, I was like, okay.
Yeah, that's what you have to really piss me off to not write calm and cooperative.
Calm and cooperative.
Like, I'm like, you have to really like do some
crazy
for me to
throw lice at you.
For me to knock you.
This might be a little crazy to you, and I'm curious to know your thoughts, or even because you said like going back to that baby doll and how she got all red and stuff. We actually had a room for craft. You would not imagine the things we had in there. Okay.
I know.
You okay, to be fair, your psychiatrist would have to be like, yes, you're allowed to do it. But within 1 day of meeting me, he's like, yeah, you can go. And there's no nurse watching us. It's occupational therapists. Okay.
Oh, okay. Okay.
We have...
At least I was like, I honestly thought it was unsupervised, and I was like,
oh.
No, there's occupational therapists,
like,
but there's no nurse, no security. We had access to real adult scissors, paint, copper work, nails, anything you can, we could do leather work, copper, like a lot.
Yeah, no, no. That's like, I've never heard of that. But it makes sense. I think for like low risk patients, I could totally see that being beneficial.
Yes.
It was fun.
So
I loved it.
about my safety. Yeah.
I mean, who doesn't love arts and crafts?
Yes.
Yeah, arts and crafts are great.
Like,
there are patients who don't love arts and crafts, I'll tell you that. But they're great. They're fantastic.
But like, again, I was more of a danger to myself, but as soon as I got there, I felt safe, if that makes sense. So I was like, you know what? I'm actually being taken serious, and I feel better that I'm not going to hurt myself. But anyone can say that. And the psychiatrist is like, oh, hey, go. You can go. But like,
yeah, I mean, and I get that. There's a lot of times psychiatrists have good ideas, kind of just looking at you, talking to you for a minute.
Right.
Like,
they
I know where this is going. You are every patient's completely different, but you are
Yes.
this category and this subcategory and this subcategory.
Yeah.
Go after it.
I'm assuming they're good at knowing who's lying.
Yeah. Oh yeah. I mean, if you've worked there long enough, at this point, I know who's lying and who's trying to manipulate me and who's being genuine.
That was the word I was looking for, manipulate.
Yeah.
Exactly.
Yeah.
Because I never did anything in there except for craft. I did copper work, I did leather work, I did all kind of things, but I was still worried that someone would take something from that room.
Oh yeah, and use it. And like whether that's on themselves or other people or both. I mean, it's a real thing. We've had patients with weapons, and you never know how they got them. And
we were talking about this on a different episode, man. You can use just about anything as a weapon.
Oh yeah, absolutely.
Like,
I mean,
half
the things that we allow
used. Like I had a patient choke me out with my own stethoscope. Like I've had my nose ring ripped out. Like everything can be used as a weapon.
Everything.
So
for sure.
It's scary.
Everything.
If you're creative enough, anything can really be used as a weapon.
Yeah,
it's true. But again, not everyone was allowed to do it. It was whoever. If the psychiatrist signed you off to do it, and obviously with me, like, I'm crazy, but I'm not. Not to say that. I hate saying that.
I'm sure that the incidents there were low.
Yes,
sure.
they actually were. Like, because I was there a total of 2 months within a year and a half, and I've never seen an incident from that room. I've seen other incidents, but nothing from that room, if that makes sense. But obviously, you're in a psych ward; things are going to happen, regardless.
Things are going to happen. It's nothing's going to be perfect all the time.
No,
some days are better than others, but nothing's going to be perfect.
Exactly.
Yeah.
Have you ever had a moment where you completely lost your either good or bad?
Have I ever had a moment where yes. Completely lost my shit, I think no. I mean I at this point I'm pretty well restrained in my emotions when I'm on the job. I would say I lose my shit more in traffic, honestly, at this point. Than I do at the job. But there are times where I do have to take a walk. Like getting kicked in the face, I'm taking a walk. I'm leaving your room. I'm gonna lose my mind in my own car. But I'm not gonna lose it right there. There have been times where I've definitely raised my voice and said things I wish I didn't say. I don't know if I'd say that's completely losing my shit though.
Right. So you kind of just were saying that before the question that you don't really lose your and you kind of wait.
I haven't yet. And obviously every situation would be different.
Yeah.
I've definitely I don't know if I feel like losing your shit is you do things that you immensely regret. I've never done anything that I immensely regret. I think sometimes some patients need a little like come to Jesus meeting, where it's like, we cannot be doing this anymore. Like this is unbelievable. We need to stop this. This has been going on too long. Yeah. But I don't know if I'd say that's losing my shit. A lot of times when I lose my shit, it's kind of a calculated effort into be like, I'm going to do this when they do this for this reason and so on and so forth. So I hope for the best, prepare for the worst is kind of one of my mottos at that job. So if I'm like, if the worst thing happens, I'll lose my shit. But that's me getting killed. I'm like, that's me. Like, you know what I mean? Like if I'm getting, I'm going to lose. Yeah, I'll lose my shit. But I'm prepared for everything up to that,
you honestly
up to the loss of life.
You honestly should, because I started the podcast doing more so like psych ward Reddit stories, right? And I moved into talking about more like trauma or people's experience in various careers or personal. And it happens in psych wards, whether it's patient, staff.
Yeah.
Not necessarily, I haven't heard yet, like staff to a patient, but a patient to a staff. And I was like, oh, like crazy.
Yeah. And I don't know, like if somebody's getting, I don't think I'll ever put myself in a position to do that. I mean, you never know, right?
Yeah.
But there would be, if I was getting, right, like, on the psych ward, the thought that would cross my mind would be like, how did I get myself in this spot? It would be like, how did this, what did I do? what did I do to allow this to even, come to fruition?
But sometimes you do nothing. It happens like.
And sometimes you do nothing. Exactly. Yeah. And it happens like that, and people lose. And it's very sad. I mean,
yes.
There have been, multiple injuries, multiple assaults. I haven't had a yet. We've had, but but you're gonna have that,
Yes.
I mean, they say like every person walks by 4 in their lifetime. It's got to be so much higher than that.
It's gotta be. Like,
it's gotta be so much higher.
I mean,
it happens more often than I think people realize. You always see like, oh, there was a shooting in Nashville where 2 people died, and I'm like, yeah, there was probably a shooting in the town over from Nashville where 2 people died as well. Yeah. But like, this one's highlighted because it was at a Chili's, like I guess.
Yes. like we don't see everything.
Yeah, it's true though.
And it's so true.
Honestly, the media pick and choose. They just like, okay, this story's interesting. This one is not.
Mm-hmm. Yeah.
And that's it.
It makes sense. It makes sense. I mean, if it's like politically motivated, let's look at it. Let's dissect why this is happening. Let's have a dialogue. But I mean, it is what it is.
It is what it is.
I don't agree with, obviously, but people are still going to be people, and they deserve to be treated as such.
Yes.
To an extent, to an extent. Like, I'm not going to grab a beer with him.
No,
but I'll give you your hypertension meds, bro.
But it's like the same thing as for, like, let's say a police officer who had to shoot someone. After they're down, they have to start care, like the basic CPR tourniquet, whatever you can do.
I'm telling you,
like,
it's hard to care for someone who's just beat the crap out of you.
Oh, completely. It's really so weird, like literally going to the ER after getting punched in the face, and then 3 hours later being like, "Where does this puzzle piece go?" Like I don't know. This is a corner piece, This is, like I can't.
It's true.
It's true. It's so true. It's
a weird, surreal feeling.
And I can only imagine.
I've realized, it's a terrible feeling, but I've also realized at this point, like I have 2 really good friends at work, and if someone hurts them, then it's harder for me to get on their page as opposed to them hurting me. You can hurt me all you want.
That's
right? Go
me.
For it. You can't hurt me all you want.
No,
but if you're gonna go after anybody, this is the guy.
Yeah,
all right? It's
right here.
No,
yes, I'm the same way.
Don't go after Jack.
Like, not on the streets.
Don't.
Not if you see me on the streets, don't punch me in the face.
Give him a hug because he's amazing.
Or maybe not.
Or high five.
From afar.
Yeah. Give me a thumbs up. Give me a thumbs up. That'd be great.
Because we'd also not like random hugs. Like, oh my god, I know you. Like,
Sorry about that. I take that back. No hugs.
Jen loves hugs. So like Jen, yes.
People. Only from
certain people. But no, I can't even imagine because like I'm not in any healthcare field at all. Like you and Jen obviously understand things more than I do. And I'm like, wow, like it's insane to me. It's eye opening, I guess.
Yeah, and you also have to realize that they're different people when they're not going through these episodes.
Right.
Exactly.
Like the guy, one of the guys, I've had a few guys that used to smear feces on his face, and one of them, towards the end of his day, was like, "Hey, do you remember when I used to smear shit on my face?" And I was like, "Yeah, dude." And he was like, "Yeah, pretty funny." And I was like, "It was hilarious," but let's not do it again.
This is a good time.
Yeah. It's funny to reminisce on some of the stuff like that.
Yeah.
And there are times where patients will recover and be like, "I'm so sorry for all that I did to you," and I'm like, "It's fine." I know the field I'm in. I completely understand. You're right. It doesn't make it okay, but we can move on from the situation. I accept your apology. Please don't let this, whatever you did, ruin your life.
Yeah.
And that's
I've had a patient punch me in the face and then sober up and come back and be like, "I'm really sorry." And I have this like massive shiner and he's like, really sorry about that. I'm like, you know what? You were drunk. It's not what you would do typically. You're still a jerk, but you know.
That's still a sucky thing to do.
So in the psych ward that I was at, I'm assuming you must have that. Here it's called CNC, which is concentrated nursing care. I think yours is called, solitary confinement.
Essentially.
Solitary confinement is what they use in jail. We call it seclusion.
Seclusion.
Or
seclusion.
the quiet room.
Yes. So we had behind the nurse station was the seclusion room. So there's like 1, 2, maybe 5 rooms. I was in one of them for because I just got in and it was for I don't remember if it was for my I think it was an attempt or close to an attempt, and and there was another guy in another room. I don't know what was going on with him. I don't know their diagnosis. They don't always talk about it, but he was screaming, banging, destroying the room all day, all night. That's all he was doing, to the point that they booty juiced him, is what I call.
That's the perfect way to describe
it. Moved them to a room. He was like out. Moved them. Construction crew had to go fix that room. Okay. He destroyed. He was butt naked, kind of sad, but everything he had his hands on, he would destroy. But after a week, he got out, and he was the quietest, sweetest man. I've even seen him on the outside as I was going to a therapy appointment. He was leaving and I saw him. I was like, hey, remember me? He's like, oh yeah, hi. And sweetest guy ever. And when you get the right medication, it is crazy how people revert back to like themselves and like the things you see and you're like, wow. So I guess I can relate in that sense, like seeing that and my own eyes, you know? Very sad. But...
It's very weird.
Yes.
They're like, sometimes they're so resistant to take their medication. I'm like, oh my gosh, please, like,
just take
like
them.
we could, we'll play chess after this. Just
I'll play chess with you.
Like I can tell how stable you are based on how good you are at chess. You know?
Yes. But
like,
here, nurses or I think the psychiatrist would have to allow it, but if you refuse your meds, especially for, I don't know, stuff like severe bipolar or schizophrenia or any type of paranoia delusion, if you don't take it, they will inject you with Abilify. That lasts for 30 days.
Interesting. Yeah. So that's probably, you were in Canada. Okay.
Yeah.
Here you have to be conserved, or you have to go through a certain type of hearing.
Not here. The psychiatrist just has to be like,
you refuse it.
Like even on my chart, reading my chart, I was allowed to be given Haldol if they had to. Like it's already there. If she needs a shot.
Standing orders. Interesting. And you're like, they have to be like a conserved individual. You know, it's not like if you came in on a hold or voluntary or any of that jazz, it would be you have every right to refuse the medication here. It's only when you're conserved or you go through this special type of hearing.
Not here.
But you have to like go to court like before any of that can happen.
Wow.
Unless of course it's an emergency. Right.
Yes.
Unless of course like you are a danger to yourself or others in that very moment, then we can, as you described it, booty juice them.
Yes.
Best term ever.
And it's true. Like even on my chart, which I was more of a danger to myself than others, but I guess they could. But my chart held all whether by mouth or injection was already checked. Like, you can do that anytime. The nurses could have anytime.
That's crazy.
Yes.
That is crazy.
And I know because one of the guy had schizoaffective disorder, and he thought he was the Messiah. He thought G Tower, the 5G Tower were talking to him. The government can hear, and he got out after like a week or two. And he was upset because they injected him with Abilify, which lasts 30 days. And he's like, I don't like this self. Like, I was like, well, yeah, everyone wants to feel like God. Like, I'm assuming that's a wonderful feeling. But
it's really fun.
But he was so mad because he's like, I'm going to be stuck like this for a month now. But here, I don't know why it's so different. But even on my chart.
It's a little more relaxed, which is interesting. I would have thought the opposite. If I'm
nurses
being honest.
can do whatever, but then I wanted Imodium. I don't have to explain why, because that was not written. I was not allowed.
What's Imodium?
And because the doctor didn't write it, because they write Tylenol, Advil, whatever, I had to wait. For the psychiatrist to be like,
you had to sit and wait is what
I literally had to sit. Okay. And so it's so crazy to me that something like that, like I had to wait for the psychiatrist to be
Imodium.
like, yeah, she's allowed to have Imodium, like it's an over-the-counter, but you can inject her anytime you want with Haldol if, you know.
There's some weird gray areas right there that I hope to never explore. That's really,
but
I don't like that. I don't love that, you know. I wouldn't want that for me.
No, but they never did it. I mean, at least they're not using, like, they weren't abusing.
Wait, they never get, oh no, okay.
They didn't abuse it on me, you know, like they never had to.
I thought you said they never gave you Imodium. I was like, that's just cruel.
Oh, no. I did. I had to wait.
I realized as I was asking you the question, I was like, oh, that's probably not it.
But what I meant is, like, they're not,
Imodium.
like, abusing their rights of using Haldol. They gave me one once because I was like, I can't sleep. I'm going crazy. I need sleep. And they're like, oh, have you heard of this? I was like, no. They're like, okay, that'll stop you from thinking. I was like, cool. I took it. And
just thinking.
Yeah, he said I couldn't sleep, and he gave me Haldol, and I didn't know what it was at the time. And then I guess other nurses were like, because I asked for it again, because let me tell you, that was the best sleep of my freaking life.
Oh yeah, it knocks you out.
It knocks you out like
Yes,
nothing.
it does.
And then I asked for it, and then 2 nurses were like, I'm not gonna give you Haldol for sleep. I was like, but I got it. And they're like, I'm not giving it. I was like, like, why did I get it?
My antipsychotic, Mom.
So that I had one Haldol experience, and it was wonderful, and now I will never, because it's a hospital use only. You can't get a prescription of Haldol.
No, it is hospital use only. You can use it in other places, but it's
hospital
it's not
use,
an
typically.
Outpatient type of thing.
It's the same for like anesthesia medication. Ativan I have on me all the time.
Oh, that's not. That's another difference.
After this video, I'll show you. I have clonazepam and Ativan.
No, you're kidding.
Do you think YouTube is gonna be like, oh, she's promoting Ativan?
I'm not gonna show you while we record. I'll show you after, because hey, my name's there and everything. I'll show you. I have a prescription for Ativan and clonazepam.
Really?
Up to 2 times a day.
Those are some cool
not
ones.
good. Because I now take 2 clonazepam a day for 2 years, and I don't think I'll ever be able to get off of them.
Probably not, and that's I mean, they're narcs for a reason. You know?
They help me. I don't have panic attacks because I didn't want to leave the psych ward. As weird as I know, I'm getting into my story. I'm sorry, but I didn't want to leave.
As you should. Look. We'll dissect your story. I'm comfortable with that. I haven't heard your story. I don't know if anybody else on the podcast has.
I haven't
done her story yet.
Honestly,
this is like reading a new book to me. Okay, let's go for it.
Because I haven't had time to talk about my story because I keep putting people before me because 15, 20 people are waiting to be on the podcast. I'm like, well, I'll just push.
Really? That's awesome. It
is awesome. But then I haven't had a chance to tell my story. But so
we'll get there.
But we'll get there. I'll get there. I have a lot
piece
to
by
say.
Piece.
Yes, I have.
Spread it out in the 20 episodes.
You know what?
I
could have you and Jen interview me. That would be interesting, actually. You know what?
Part 2 is Steph's story.
Part 2 is Steph's story. I have so much to say, but I'll show you after the video. I'm not gonna put my pill bottles here. But I hear nurse practitioner could prescribe it, doctors, whatever. But this is a psychiatrist that's prescribing them to me. But I'm stuck. But it helped me for my panic attack and helped me want to leave the psych ward because I was one of the patient at the first time that I did not want to leave.
It's weird how that happens, right?
Yes.
It's almost like a Stockholm syndrome type of thing.
It was. Is it? I'm French, and I'm sure you probably clued in, but respite care, is that how you say it? Okay.
Yeah.
Mm-hmm.
That was probably the big thing for me. That I don't have to cook, I don't have to clean, I don't have to. I have a newborn at home, and every time I go home, I panic. I have panic attack, and I have to go back to the hospital because leaves are also a thing. I don't know if yours were allowed to, but we're allowed to leave overnight sometimes.
Nope.
Oh my God.
Usually if you're
we have
leaving
so much to talk about. This is crazy.
Never.
Oh yeah,
never
we're
had
allowed.
that.
Yeah,
and I've had people leave overnight because they escaped.
No.
And that's like.
I want to know about those.
No, like I'll even show you documents like personally, not on camera. But you're like, it was called leave pass. You could leave for part of the day or overnight on weekends. And then they're like, how did you do? They'll give you Ativan because everyone's allowed to have Ativan. Like you go to a nurse, you're like, can I have an Ativan? Here we go. Everyone.
I think all my patients would love going to Canada.
Yes.
You get scissors.
Everybody
you
should
get to lead. Yeah.
You get, we're allowed to go for smokes.
You get to lead.
We have smoke breaks.
To smoke. Like,
Okay.
none of my patients get that.
We get
That's crazy.
So I'm gonna stop it here because I know I'm getting too far in my story. But yeah, we're allowed to go for smoke between, and no one comes outside with us, so anyone could just like run.
Wait. Nobody comes outside with you. You guys have like lighters and stuff like
Right.
that. All right.
I promise.
That's great.
Swear.
That's great.
On
go Canada. You know,
kid's life. This is true.
This is the thing.
I would not lie.
No, I didn't think you were lying. I'm just like, all right.
We're a very open place.
So they keep the lighters in
Literally.
the desk, and when it's smoke time, we all rally up, and they're like, cigarette lighter, cigarette lighter, cigarette lighter, and then we
imagine?
wait for them. We're like, push the button, open the door, and then we're all like, phew, we have 20 minutes. We have to be back within 20 minutes.
And then they let them come back and play with scissors and copper stuff.
Yeah.
And sulfur, because you have to use sulfur to make something. Anyway, yeah, chemicals.
What was it? You play with rope? Like, what's going on? Like,
We're allowed to have shoes and laces, so I guess, yeah.
yeah.
Yes.
What?
Yes.
See, yeah.
But
Yeah, we are getting off topic, but this is interesting. Where
So
it's
we're
like
gonna do
so different.
part
Yes.
2, Steph's story.
Yeah.
What did your darkest moment look like?
Oh, the darkest moment on shift.
Yes.
Okay, darkest moment on there. I could do two of them. One literally, one figuratively. The darkest moment is I got assaulted pretty bad, and I did one of the stories about it where, you know, it was like hour 14 on my shift. I was ready to go home. You know, I was a little upset with this patient. I was charged on one station, and somebody else was charged in the back, and they had never done that before, so it was a stressful day for me already. And then they did something they should not have. We got them over to an X-ray. I was upset with them because I had worked with them so well, and they had come so far, and for almost no reason just reverted back into who they wanted to be, right? And then she assaulted me pretty bad. I remember like my shoulder was dislocated and all this jazz, and I remember just being like, I cannot believe like weeks and weeks and weeks of work has come down to like having my hair pulled out and being in the like having like sitting in an ER bed and the thing is like I was charting in the ER room, like in my ER room, like I'm like charting this incident. I stepped up to handle the situation. Not that nobody else would have. I work with great people. But I had to be in the ER because I had to get checked out. I had to finish this charting. Like I didn't want to be there anymore, but I knew I was still doing what I had to do, you know? And I remember just like thinking like laughing about it, but also just being like, what am I doing? Like I could have been way more hurt than this. And I was not, luckily, but it was a dark moment mentally, there for sure, just because I had done so much with them and it was for nothing. All it did was delay the inevitable for a few weeks, and all that like time and energy. I'm like, what could I have been doing something else productive with another patient or so on and so forth. I mean, you only have so much time in a day, so
right.
Yeah.
But what was the point, you know, is what I remember thinking. Obviously
so
you get
hard.
over that. Yeah. Another one of those moments where the darkest, I will say physically, is when I was punched in the face and blacked out.
I knew you were going to go there.
I set it up. I put it on a T-gen for you to hit.
He's going to say something like the lights went out.
So the first,
Yeah.
first story he said, I watched a video. You got kicked in the nuts.
That was the initial thing. Got kicked in the nuts. She pulled out a lock of my hair, right up
your
here.
hair.
She touched your hair?
And when you went back for X-ray, you found
because
the
my
hair.
beanie came off.
Yes.
My beanie. No. I want my job.
And I'm like, but you said
So
your video was funny, but I'm seeing the other side, and I love this because
it was devastating for sure.
Yes.
I mean, I can make anything. Like I can find light in any situation, right? But it was devastating. I was out of work for a week. I had to go back. I am getting surgery on the shoulder in the next few months.
God.
But I can do most of what I can do already. It had been injured before too, so it was a second dislocation. But I mean, doesn't help for sure. I mean, definitely escalated things and advanced it. It is what it is.
It doesn't even seem like it's the physical that's affecting you. It's the fact that you worked on this person for so long and you thought the expectation was like, oh, I got her in a really good place, and then she switched.
Something switched.
It's like, I mean, sticks and stones may break my bones, but words may never hurt me. It wasn't like words definitely hurt me there more than the sticks and the stones and the kick to the nuts. Kick to the stones. It was right in front of me.
So
I want to laugh and I don't want to laugh. I'm like,
I'm setting it up for you. You guys are allowed to laugh, okay? They're like, absolutely.
I know, but it's just like I feel for you, but you make it funny. Stop it! No, don't stop.
That's the way to do it. I mean, do you want? How much more awkward would it be if I just sat here and cried? Okay, like it would be tough. It would be really tough. I'm sure. Look, here's the thing. I'm sure it happens, and you guys do not have to comment on this whatsoever. I'm sure this episode is way more fun. Like Jen
and I
cry. So we're good.
Yeah.
Cry.
No, I'm not going to make you cry.
For happy tears.
Yeah.
I swear to God, we cry all the freaking time because people tell us their trauma and we're like, oh my God.
I'm
and
just
we
shocked
cry.
at some people. Like the shit that they go through, like I'm just like, man, I thought I went through some hard shit, and I did. But some people, I'm just like, how are you still upright in the world right now?
No, and I definitely go through some hard, but I blunt it. Like I think like a lot of events that I go through are more devastating than I'll allow myself to believe.
Right.
And so that blunts it for me, and I blunt it for everybody else. You know, I think it's like, is that a positive coping skill? Maybe. Yes and no. You know, I mean, is it internalization? Yes.
Yeah.
Is it working? Yeah. Right
for now.
I mean, we'll see if it continues to work. It probably won't. You're gonna see me in 5 years and I'm gonna be on like one of those like Daily Mail things. It's gonna be like, what happened to the nurse Jack?
Where is he now?
Where is he now? There he is.
He's in the psych ward.
He has a beard now? That's bad. That's
he's
not
bald
good.
with a bald spot.
Yeah, he's bald with a beard. He wears a beanie on his chin? How does that even happen?
I can't.
But I hope I don't get to that point. We'll see.
Well,
you never know.
I know exactly what you mean, but mine is avoiding. That's my coping skill. I avoid until I can't. And then I'm like, well,
I just try to help
everything
else.
Works until it doesn't. You know?
Exactly. So might as well use whatever works.
And look, every bike chain rusts. Okay, like it does.
So true.
Oh,
so
my
true.
Lord. When did you first realize your mental health was being impacted from your job?
You know, it's hard to, hold on. It's hard to kind of pinpoint mental health for my job as opposed to just my mental health in general, I would say. I've struggled with mental health most of my entire life. One recently where I was like, oh yeah, I definitely, it's been impacting me. I mean, I've had a lot of these moments. First, I don't know if I could pinpoint first. I'll go latest. This is my first day off. I have 6 days off in a row. Woohoo! But I had just worked. I just worked 6 out of 7. Okay, which means it's I just worked about 72, 75 hours within the last 7 days, which is it's a lot.
It's a lot.
And I had 1 day off in between, and that 1 day off, my wife and I and a friend of ours went out for coffee, and I am always the person that responds to like, you know, assaults or any of that across the hospital. Like they say it over the intercom and all that jazz. And so whenever they start something over the intercom, I like freeze and like, cause you have to I'm like, I don't know what my you drop everything. I don't know what my next move is. You know?
Yeah.
If it's my code, if it's not my code, but I was in the coffee shop and he was yelling out names and he went, Cody. And I I literally froze.
Oh my
and
God.
My wife looked at me, took a sip of her coffee and was like, you need therapy. And I was like,
Sounds amazing.
Yeah, she's
like
great.
a form of...
It takes a very special person to deal with this every day.
Dude, I hear you. My wife is a saint.
She's the best. Right.
So like that's
and
like
I don't even currently
PTSD.
do it.
You thought you were at the hospital for that moment, and you're like,
It kind of it was just more so the visceral reaction I had to it to just hearing like the first like syllable of my like code. Like, and I was like, and like, I knew I wasn't there, but it was like, where am I? I was like, I don't know where I am. Where am I running to? You know, like,
that's the thing. Like, I hear sirens and my hands start sweating, and I'm constantly like, my head's on a swivel because I'm like, where do I need to be?
Yeah.
As soon as I hear sirens, and it's been 10 years since I've been on the truck.
It was the same. It's the same. You know, like I completely get that. It's like a PTSD thing, and like I would say a majority of the time, you know, I respond to these incidents and I'm able to resolve them without like physical conflict or anything like that. But that doesn't always happen. You know, I mean, it is difficult sometimes, and every time is completely different. There's no playbook on how to do it. I mean, they can teach you all the training in the world, but it's like they're not teaching you for this specific person who has 4 fingers only, but they have the longest fingernails in the world. You're like, oh, I don't know how to approach this. She's gonna scratch me, you know. Like you just never know, right? And so that was
it's so true, though.
Right? Yeah, it is. It's
like,
so and here's the thing, like I'm not describing any specific person, you know, but like but I yeah.
Yep. No, I
definitely some PTSD that I don't recognize. I don't think fully. That needs attention.
I would say so. Like I struggled with PTSD, but completely different. It's not career based, but this definitely sounds like career based PTSD.
I just feel like we're so much alike. You're like, I might need a little help with that. See what happens.
It'll come. It'll come. It'll come with time. I've got 6 days off. You know, I'll figure it out. I guess maybe. We'll see.
I'll just send you ads.
He'll just send you care packages.
Look, if it clears customs, all down. You know, I'm down with it.
All jokes aside, I'm not gonna send benzos. No. Okay, just YouTube.
Can you imagine?
I'm not doing
that.
Yeah. So, was there support when you needed it, or did you have to go through it alone? I guess.
I would say there's always some type of support. I would say sometimes it gets lost in the cracks, slips through the cracks, lost in translation, all that jazz. I think there's always some sort of support if you really need it. I feel like I only take some types of support, like other types of, everybody's different. It's like coping skills and all this jazz, where it's like most of this, like, let's sit down in a circle and talk about it. Go get, like, I'm not going to sit around. I'm not going to, there's no way.
No.
Why would I want to do this?
No.
Where you're like, oh, everything's going to be okay. I know everything's going to be okay. It'll be fine.
Yes.
I don't want to talk to you right now.
No.
Is that too much to ask?
You're speaking to my soul right now.
Right?
Yes,
like that doesn't work for me. I'd rather like go and like, if a friend is okay with me talking to them, I'll talk with them.
Yeah.
And like, one of my best friends works with me, and so it's kind of nice to like bounce off of each other, where it's like, and we also have like a thing where it's like, hey, if it's getting a little too much for the other person, I'm not going to do it. I'm not going to listen to you. You're not going to listen to me. Well, that's like, you have to have those boundaries. But I think if you set up, the ability to have support, if you surround yourself with the ability to have support, in which I understand I'm an extroverted person, it's a lot easier for me than a majority of people. But if you do that, I think it sets you up for better success for sure.
I 100% agree with that.
Yeah.
Yeah, like Jen and I have boundaries too. We became very close because of this channel, but if she has to hang up because I won't shut up, she'll tell me like, shut up. Like I have to go. I'm like, okay, I gotta go. Like just like I won't take offense to it. Like I know I talk. And same thing if Jen talks too much, I'll probably tell her like, stop, I need to go, or
stop, I need to go, I missed my dose of Imodium.
I'm never gonna live this one on my own.
I was like, I gotta get 2 of them in. I gotta get 2 jokes about Imodium in, and then I'll hit my quota. And I've hit my quota. We're good.
I'm gonna be known as Imodium girl.
Oh god. Good. Oh my god. So funny.
I don't even care. I love that. Oh god.
What's a misconception people have about your line of work?
I think the misconception they have is not necessarily for me, but more so the patients. I think a lot of people don't understand really what goes on in there. And there's obviously a lot of stigma behind it. I think there's a lot of times where if people have family members that are in there, they look at us, depending on how the family member comes out or how the family member is. Did we help them? Did we not help them?
Right.
They'll look at us in a bad, negative light. Kind of regardless, because sometimes the patients will call and be like, hey, they're treating me like this. And I'm like, it's not like this at all. This is just the mindset that they're in at the moment.
Right.
Yes, sometimes you're being held there against your will, and that is true, but it's for yours or someone else's own good. It's better than being in jail because you're not going to be here forever. Some patients are there for a really long time.
Yes.
But nevertheless, and I think there's a misconception too on the patient side of things where, you're like, oh, you're in a psych ward. Ooh, like that is something people will not get offers to jobs for. No matter if you were in there for 8 hours or you were in there for 8 years, that's like, you were in there. It's there. That's what it is.
Exactly.
And not this, America is very much a very gun-friendly place is a good way to describe it. But like, and I've never held a gun. So you kind of know where I stand. But regardless, it's like if somebody's in there for 72 hours for whatever reason, and then it's like there's a stigma put on you where, at least in the state I'm in, probably not all states, where it's going to be a lot harder to find firearms for over 5 years. And that's half a decade. And, that's, maybe not everybody should have a firearm, and they shouldn't at all.
Read.
At all. But if it's like, if you're a hunter,
right,
and it's like, oh man, like if you live on a farm, like, that's like destroying your livelihood right there.
Yes. 100%.
And again, not pro gun. Okay, want to point that out. I think a majority of people I think everybody should have a 5-year probation, but unless you're a farmer or a hunter or something like that, I mean, there's like, that's another. I'm just pointing out stigmas.
No, absolutely.
This is personal opinion, guys. Don't come after him. Everyone's allowed to have an
if you're
opinion.
a gun nut, come after me. I like.
Yes.
Come after me.
I just like to put
I will fight you all day on it. Okay.
I got your back. I got your back.
Come at me. Don't bring a gun. Okay. Like, but come at me.
I'm like, don't. Like, everyone's allowed to have an opinion, and when we get into like stuff like that, I like to say, you're allowed yours, he's allowed his. No one go after anyone.
Leave a comment, okay? My followers will eat you alive. All right. My 65-plus-year-old grandmas will eat you alive.
Yes.
Come
Old
at me.
women love nurses,
like,
male
please
nurses.
come at me. I'm sorry. This is.
You are not going to hurt my feelings. I do not care.
See,
I will not read your comment. I will be like, why is this video getting an extra 200,000 views? Oh, it's because of gun nuts on it? Fine. Comment on another one, please. Do it. I could not care less. I'm not going to look at your DM. Like, what? Like,
I can't breathe.
I'm here like trying to like be mama bear because I know like you have a lot of people that loves you, and I'm like, please don't go after him for this. And you're like, come on, bitch.
I'll fight. You don't think I've been punched in the face before?
Oh my God.
Listen to 30 seconds ago. Okay? I have.
I can't even laugh anymore. Oh my God. You're the best. You're the best.
Oh, okay.
Okay. Woo!
All right.
Go after him, guys. I don't know what to tell you.
You're my freaking hero. I love you.
Yes, you are. You're a hero.
Oh my God. All right. So, moving on.
Sorry about the gun tangent. Wasn't this question about stigma? That was like, it ended up being about guns. I don't even know how I did that. That doesn't make any sense.
I don't. I'll have to rewatch it to know how that's
a great tangent. I love the segue though. It was amazing.
Yes.
Let's talk about the stigma. Guns.
Yeah, guns.
That's it. Guns.
Let's talk about AK-47s. How about? Let's not talk about stigma.
Okay.
Oh, okay.
Legit. Having a hard time to breathe. Okay. Okay, so how has your workplace trauma shaped who you are today?
I think it's maybe a more understanding person, for sure. Like without a doubt, definitely more understanding. People go through different various events, that affect everybody in different ways. Like me getting punched in the face affects me one way. It'll affect somebody else a completely different way. Yep. The exact same incident. It's all about kind of your makeup and chemical makeup, really, in your brain, and how you choose to decipher, or how your brain chooses to decipher different information. So when I hear I think when I first started on a job where it was like I got assaulted and then X got assaulted, I'd be like, and they're not back at work, But I think over time, you change as a person. You realize, I like some of the things they've been through, I could not handle, the way that they are handling it, and they can't handle the way that I handled certain situations. So it, without a doubt, has made me more understanding just from that simple aspect itself.
And
That's
may I
amazing,
add, I think it made you funnier.
Maybe. It definitely could have.
Because first responder, military, nurses, I consider nurses first responders in a sense sometimes, because you guys feel...
coffee shops don't.
So
I still
you guys, dark humor. Dark humor, that's where it comes from, okay? Dark humor.
It's true, though. Like, my dad was a coroner, and my sister was like... We come from a very medical family, so our dinner table conversations were not everyone else's. So when we had people over, they were confused.
Or disgusted.
Both sometimes.
They would be like, I'm not eating the rest of the sausage. You just talked about for 20 minutes.
Or makeshift built.
Yeah.
But I love dark humor. You could talk about, he smeared the oh yeah, okay.
And that's the thing is, like, I don't think it's necessarily like, here's the thing with dark humor is it's hit or miss. It's either your taste or it isn't. And a majority of the time, if you've been through trauma, you've survived trauma, if you're making a joke about that like specific trauma, or like somebody's like ailment in a sense, right?
Yes.
The person that's going to get mad at you is not the person suffering from that.
No.
It's the person who knows someone who is suffering.
Yes.
Yeah. Yes. Where it's like, my friend is in a wheelchair, and it's like, your friend in a wheelchair is crying laughing. Okay.
Yes.
She's just loving this.
Thank you.
Are you kidding me?
Thank you.
I just called her Wheels, and she's like, yeah, that's my new nickname now. All right.
Yes. Thank you.
Like, and you're out here like,
it's always like the person who's not affected that's offended, and I'm like, shut up.
I would say that's like 99% of the time.
Yes.
Absolutely.
Like,
I think there are times where people who are affected by these ailment will be upset. I mean, there's always the anomaly, right? There's always the odd person out.
Yeah.
But if it helps 19 people and offends one, that's a hell of a ratio.
Yes, exact. What advice would you give to someone who's looking to get into your field?
This is gonna sound bad, but don't try too hard. And what I mean by this is, like, find a school life balance. Don't, like, I have a lot of people that message me. They're like, how did you get into this field? And I was like, it was kind of random. Like, if you're somebody that wants to get into mental health, I don't know if becoming an RN to work as a nurse in the behavioral health unit is what you're going to want to be doing.
Interesting.
I think if that's something you want, test the waters first. And in America, we have mental health workers, which is basically a CNA without the CNA license, okay?
Okay.
And so what you can do is you can work with mental health patients being a mental health worker. If you want to do what I do, you probably don't, okay? Like, you can see it, like, I'm being serious. You could see it from an outside perspective, and you're like, that's so cool that you're working with them. You can work with them in other ways, all right? Like, the way I work with them is definitely not how you want to go about it a majority of the time. I'm not trying to deter you away from being a nurse. I'm not trying to deter you away from being a nurse on a behavioral health unit. What I am trying to say is test the waters first.
Yeah.
Don't set your sights on just being this, because nursing has so many more opportunities, and don't close yourself out to just be like, I want to be a psych nurse. You may flip-flop me. right? You may be like, oh, I'm going to do my preceptorship in behavioral health and then take my job in cardiology. You know, like
yes.
that, like, you can be so much more smarter than me. Okay. Like, the world is your oyster. All right. The world was not my oyster. I'm a smart individual, not that smart. Did not finish top of my class. I'll tell you that for sure. But like, be a mental health worker, test the grounds. There's ways to volunteer and stuff like that. So do that. And then if you want to go through school, find a good RN program. Don't take it too seriously. I finished in 4.5 years as opposed to 4. Sometimes you're going to fail. Don't expect to be perfect. Okay.
Right.
And don't expect to not have your own mental health troubles as well.
Yes.
I think there's a lot of times where people, there's not a good in between, where it's like people either have very bad mental health issues and have a hard time even dealing with those, and then are like, I'm going to help others. And I'm like, why don't you stick to yourself first? Okay. And then we have people that have never had mental health issues who have trouble connecting with patients, and are like, oh, I'm going to help them because I got my together. And it's like, that's not what anybody wants to hear.
Yeah.
You got to find an in between. And I'm not saying if you're either one of these people on this end of the spectrum or this end of the spectrum that you can't do it. You totally can. Okay. Yeah. I just think it's not going to be as enjoyable as you are imagining it to be.
Right.
Yes.
It's everything you see, what I do on social media. Yes. I can twist the stories and make them funny and all this jazz, but that's one story. You know, that's not all the stories. That's not everything that's in between. That's not things that I don't share or talk about, or even mundane part of the job.
Yeah.
I mean, there's a lot of stuff to it that isn't just direct patient care. But I would test the waters first while you can. Everybody's looking for opportunities. Everybody's looking for mental health workers and, volunteers and stuff. So test it out. Don't take it too seriously. All right.
That's great.
Yeah, I couldn't agree with you more. And in nursing, you have so many options. You could be plastic surgeon nurse. You could be ER nurse, which is probably just as traumatizing. You could be
I love my
cardiologist nurse, or you could be in. Oh my God, there's so many options.
There's so many. You could be a nurse of a word you don't even know. Like
probably.
Like, there's that many fields in nursing.
Flapologist.
Flapologist. That was from yesterday's episode. I'm sorry. It's not even out yet.
We talked to someone yesterday, and someone was a flapologist, and I was like, I want to be a flapologist.
It's about airplanes, okay? That's all you need. It's not.
Okay. A flapologist.
I did not take it away.
I was like, see, I didn't even know that one, right? Like,
and we laughed about it because, I was like, oh my God.
Yeah, you could probably. I mean, as far as I know, I said I'm not the smartest. I don't I missed that class probably.
No, it's not even a real word. There's another word for that, but they call it that. Anyway, it's another episode completely. But we had a laugh at that one.
Sorry about that. Okay, so I guess, I don't know, maybe you already answered this. If you could go back and talk to your younger self before starting this career, what would you say? And I feel like the last answer might bleed into this
exactly that. Also, I would probably say you're doing fine. I mean, I remember being stressed about grades at times and being stressed about certain things and like moving and stuff. And it's like, you'll be fine. You'll figure it out.
Yeah.
You've got good people skills. You got this.
You'll be okay.
You'll be fine. Next thing you know, you'll have like million subscribers.
All right. Jack, put the razor down. You're good. All right, bro. You're good. Everything works out.
Everything works out.
Everything is fine.
How it's
Everything's fine. Everything's fine.
Like that fire meme. Everything's fine.
Yeah. That's my mantra.
Yeah.
I'm fine. Everything's fine.
Everything's fine.
Yes.
Everything's great.
With that laugh.
When I laugh, I'm going to cry.
Yeah, exactly. People might take parts of these videos and I can't control this.
Yeah. I really hope people realize when I say put the razors down, like I'm not making fun of anybody. I did that. I know. I've been there, done that.
Me too.
Yeah, that's probably where I go back and tell myself.
That's like I'm not laughing at you.
This isn't worth it. Yeah.
I relate. Like I know.
Yeah.
I know. What's one thing that helped you heal that you never expected?
Oh, I actually really like this question. It's one thing that helped me heal that I never expected. Whoa.
It's a deep question.
I like this.
The wheels are turning.
Oh yeah, I can see it.
The smoke.
Diving into it. But what I mean by this is like diving into the feeling. Like I go through depressive episodes all the time. I fully commit. You know, like I'm not gonna fully commit and like, you know, but I fully commit to being sad. You know what I mean? Like,
yeah.
I think I said that wrong too. I meant like fully committed and like do nothing about it. But like I saw your guys' faces where, you know, words can mean two things.
They're not actually laughing this time.
Yeah. I saw your guys' faces, and I was like, oh, okay, that's what they thought.
I'm go after this.
Yeah. No, but I'll like fully commit to being sad. Like there are times where, you know, dwelling on the event kind of helps. Yeah. As long as it's not hurting. You know, it's everything in moderation, right? Like you should, if you're upset about an event, be upset. You know, be upset. Don't let it be anybody else's problem because it's not. You know, but like be upset. That is your emotion. You're allowed to feel your emotions. Your emotions are validated. The other thing I would say is no. You're good. Go.
I was just gonna say I literally have a playlist on Spotify that's called like sad/mental health. So if I'm having a moment,
my playlist on Spotify is once a sad girl, always a sad girl. That is.
Can you send me that playlist? It is.
It's a lot of Phoebe Bridgers. That's
So I have my sad music for if I'm sad. I need to listen to it and cry, then that's what I do, and then I'm okay.
I listen to murder podcasts.
That works too.
Yeah.
Fully commit.
You fully commit.
I might be seeing you soon, but like fully commit. Go for it.
What's your favorite guilty pleasure that helps you decompress?
Ooh, favorite guilty pleasure. There's a few of them. I would say, I think it defines what you define a guilty pleasure as. What's your favorite guilty pleasure? My favorite guilty pleasure.
That could be a TV show or us walking your dog or.
It's walking my dog a guilty pleasure. I feel like that's good for my dog. I feel like that's just a chore, like doing my laundry.
Something that needs to be done.
Yeah, I think a guilty pleasure of mine. There's this one YouTube channel, his name is Poofesher. He does like this is totally a guilty pleasure. He does like he'll play through like Wii video games. Okay. And he like comments on them and stuff. He'll play like Wii baseball and stuff. And it makes me laugh. And it's completely a guilty pleasure because it is embarrassing to still watch post. You know, like this is a big thing that happened like during you just watch people do this stuff. It is embarrassing to still be doing it. But it totally is a guilty pleasure. Him losing his mind at an error at third base.
Okay,
hilarious.
So he's not
keeps me grounded, really. Like he'll be screaming at the top of his lungs, and I'm like, yes, like that's what I want. This is great.
Okay, so he's not like making it funny on purpose. He's actually getting angry.
Oh yeah. But like, I think there's a part of it that's show for sure.
That's their but still.
But like, he's good at it. I'll tell you what.
I don't care if he's real or not.
I don't care. Look, I know Pinocchio's not real. I'll still watch the movie. Okay,
right.
That's like, it's the same thing. It doesn't have to be real if it's funny. Like it's like you can get angry at this. The game, that's my guilty pleasure. I'm not gonna get into like dissecting this, but yeah. That's it.
I love it. Yeah, a lot of YouTube videos I love, so I'm gonna check that out. I'm curious.
I would say like a lot of YouTube is guilty pleasure in of itself. I actually stopped posting to YouTube because it was so much harder for me. And I was just like, I'm not getting anything out of this. There's like, it's like starting over, and I don't really want to start over.
It is. I noticed because I went to see some of your videos on YouTube, and I was like, what the hell, 1K view?
I took them all down.
I was like, why?
I took them all, exactly. That's the other thing. I just took them down off of YouTube.
You go on Facebook or TikTok, and you're like 23 to 50K view, and I'm like, what's wrong with YouTube?
23 to 50K, and then you're like, oh, this video on YouTube got 1,300 views, and this video on TikTok got 11 million. Like it's just like, I don't need to do that. I mean, I'll figure out a thing to do on YouTube.
YouTube, do better.
Yeah.
This is going on YouTube.
Come at me. Okay.
Yes. I'm telling you, we are soulmates.
You have Come at him. Go. That didn't make sense. I'm French. I'm using that excuse. Okay, it's my first excuse today. Go at him.
His excuse. That's fine.
And the very last question is probably one of my favorite. And I asked every guest, regardless how serious or not the episode was, because we're called Grippy Sock Talk. So it's Grippy Sock time. If you had to be locked in a psych ward with one person, real, fictional, dead, alive, who would it be and why?
Cleopatra, without a doubt. Cleopatra off the bat. She's first off, in a time where men ruled, she ruled. Okay? She got so many people to do so many things, and she was so smart. Was she evil? Jury's still out, okay? There was no jury at the time because she made sure of it, all right? So it's Cleopatra. Like, no doubt about it, Cleopatra.
Okay, you didn't even know the question. Like, you had no idea what we were going to ask, and Cleopatra, right away.
Do you like Cleopatra? Like, have you looked into the history? Do you like Cleopatra?
Absolutely. I just find it fascinating.
No,
I
agree.
I very much do. I mean, she wasn't a great individual. I understand.
I mean, she's crazy, and I loved her.
She's crazy. Yeah. Exactly. She's crazy, and it would make sense. Like if Cleopatra's in psych ward, you're like, I get it, Cleo. Okay,
I get it. Like we'd have a blast. She would rule the whole psych ward. Okay.
Oh my gosh! Do you realize how many people would be wrapped in toilet paper as mummies? All of them. It would be all of them.
The nurses, the doctors, the patients. Everyone.
And because here's the thing, also Cleopatra would figure out a way to get out.
Oh,
that is no doubt. She would be like, she would have everybody's sets of keys because they gave it to her because she's Cleopatra.
Yes. Oh my God, that is so you'd have an escape. You'd have her on your corner, and
not that I'm saying it. Not that I'm saying the goal of the psych ward would be to escape.
No.
That is not what I'm endorsing. What I am endorsing is Cleopatra would be good at it.
Yeah. Right? She's not endorsing it. Okay?
Yeah, exactly.
Do not try to escape psych wards.
I'm stating things everybody has thought of. If Cleopatra could escape a psych ward, that's like everybody's thought of that. It's the new Roman Empire. Let's start that trend. Okay.
To piggyback off of what Steph just said, if you're gonna escape the psych ward, write us and tell us about it.
Yeah, I will.
Yeah. Well, mine is easy. I just go for a smoke and I'll come back.
Yes. Yeah, that's an easy one. Mine would be like, how'd you get a power saw to cut through this door?
Arts and crafts.
Yeah, arts and crafts.
I shoved it in my prison purse.
I hooped it.
Sorry.
Oh, man.
This episode, honestly, I was expecting it to be funny. Okay, let's be real.
I mean,
I watch your videos. You're hilarious. I assumed you were an extrovert. You're even more. You're giving me like real. I don't know how to explain it. You're real. You're you. Does that make sense? You're not hiding. You're not. You don't have a facade. This is you, and I love that.
Yeah.
You're not like. I don't know. I'm sure there's other influencers who are so different and behind the scenes are different and on the camera they're one way. You're not. You're just you. Okay, what we see is what we get.
And your hair is amazing.
Oh,
thank you.
That's the first thing I said, guys. I saw him. I was like, "Your hair. Can I have like?" I'm not gonna rip it, okay?
So many people think I'm bald. They like, and it's like weird. I'll get a lot of messages like, "Show me underneath your beanie," and I'm like, I'd never message me again. Like,
just start an OnlyFans and we're like so slowly.
what? Once a week, I just pull off my beanie.
I'm gonna have to.
I get like different views. Like this one's from the back. You gotta. That's like a pay-per-view thing.
I'm gonna have to blur your pay for the whole episode.
I would totally do that if grandparents knew how to work OnlyFans. Like, I would get nobody. They just message me like, "How do I even pay you?" And I'd be like, "You don't.
Just don't.
Like, just
enjoy.
Just take your lisinopril and go to bed. That's fine."
I can't. I knew, like I said, I knew it was going to be hilarious. I'm hurting right here, right now, okay?
Seriously, face hurts.
We got some serious moment, and we got some real moment, yeah. And I appreciate that because that is not your typical content, but it's nice to see the real.
But I can be. I'm a serious individual when I want to be, for sure.
With a smile on his face.
With a smile on your face.
Did I say serious? I meant mischievous individual.
I like it.
Yes, but like, yeah, we got to see the real you, and I love it. Mostly funny because I think that's who you are. You're a funny person. You're a comedian, and it's just in you. It's part of you. But you also had some real serious moment, and I love that too. We got the raw, the real, and again, we saw him backstage before we started recording.
This is not my car.
Okay. This is not his car.
Backstage is like the trunk. That's like where it is.
And I can say to everyone, like, this is like he's not acting. This is him. This is what you get.
He's amazing.
Go at him. Go at him.
I dare you.
Take videos.
That's what I'm gonna end the video with. Do it, okay?
I dare you.
Like, subscribe to my channel, share, do everything.
Chill out.
And go at him.
Come on.